Headaches are something everyone complains about from time to time, but if you experience headaches every day or more than a few days a week, you may be suffering from chronic daily headaches. Chronic headache is a headache that causes limitations in daily life. Long-term and effective treatment of chronic daily headaches can be successful by reducing the frequency and intensity of the pain. Some causes of non-primary chronic daily headaches include problems with blood vessels in or around the brain, stroke, infections such as meningitis, intracranial pressure that is too high or too low, brain tumor, traumatic brain injury, excessive drug use headache. Episodic headaches develop in people with migraine or tension headaches who take painkillers too often. If you take painkillers or analgesics more than 2 days a week, you are more likely to experience rebound headaches. At the end of the video, we explain how you can treat headache with natural treatment methods, so we recommend that you watch the video to the end. But first, let's learn the causes and symptoms of headache. Let's start if you are ready.
If you want to get information on other important issues related to healthy and long life, you can like the video and subscribe to the channel. Thank you for watching.
If you suffer from chronic daily headaches, it can be accompanied by depression, sleep, and anxiety disorders. You can make some simple preparations before going to a doctor's appointment. For example, you can keep a diary of the severity of your headache, how long it lasts, what you did when it started, how long afterwards you took medication, whether there was a triggering condition beforehand. You can ask your doctor questions about chronic headaches that worry you. Which tests are necessary? Is my condition temporary or persistent? How can I manage this condition in combination with my other existing health conditions? Should I see a specialist from another department? Are there any printed materials such as books, brochures, etc. that you can recommend? You should not hesitate to ask your doctor questions such as which websites you recommend me to read. Also, do not hesitate to ask any other questions you may have. A headache for at least 3 months or more than 15 days a month is a chronic daily migraine. In primary chronic headaches, radiological imaging procedures do not reveal any other cause of pain in the brain. There are 2 types of chronic daily headache, short or long-term. In the long-term type, the patient experiences pain for at least 4 hours every day. Not every headache is chronic migraine, and not every headache attack is migraine. In patients with episodic migraine, chronic migraine is when the attacks become frequent and persistent. Chronic migraine is diagnosed if the patient has more than 15 days of pain per month for at least 3 months, 8 of the pain has the character of migraine, and the patient suffers from pain for more than 4 hours. Migraine is accompanied by these characteristics of a headache. It can affect one side or both sides of your head, throbbing sensation, moderate to severe pain, may increase with routine physical activities, and it causes at least one of the following: nausea, vomiting, or both, hypersensitivity to light and sound. These headache attacks are usually mild or moderate in intensity, with pressure or compression affecting both sides of the head. Some patients may experience tenderness of the scalp. Routine physical activity does not affect or increase the pain. This type of headache occurs suddenly in people who have not previously complained of pain. The headache becomes constant within the first 3 days. It is mild or moderate, affecting both sides of the head, causing a feeling of pressure or squeezing. With this type of pain, routine physical activities do not increase the pain. Occasional headaches do not require medical intervention and are temporary. However, if it lasts more than 2 days a week, if you need to take 1 or more painkillers with each headache, and if it gets worse than your usual headache, you should see a doctor as soon as possible. The causes of primary chronic daily headache are not yet clearly understood, and there is no underlying cause. Chronic headaches require a medical examination. Normal headaches can be managed without medication. So how to get rid of a headache? What should people with frequent headaches do? Headaches become unbelievable and unbearable over time. Headache, which also negatively affects our daily lives, can sometimes be very severe and sometimes milder. It is much better for health to find natural solutions to relieve headaches instead of taking medication. Here are the natural remedies that are good for headache that we have compiled for you. Known for its calming and blissful effect, lavender is very effective for headaches. Lavender scent minimizes headache and migraine symptoms. Especially for stress-induced headaches, it will be good to drop lavender oil into a glass of water and smell this mixture. Prepare a mint-lemon mixture that attracts attention with its refreshing and tension-relieving properties. Soak a clean cloth in this water, put it on your forehead after squeezing it and leave it on. You can repeat this process frequently. Another suggestion would be to smell mint oil. Ginger with pain-relieving properties is among the preferred ones. Especially consuming ginger tea will relieve the headache considerably. It should not be forgotten that ginger has very beneficial and positive effects on the body. Yes, you did not hear wrong. It is 2-in-1, both hot water and ice packs. Placing an ice pack on your neck and a hot water bag on your feet will relieve your pain. The reason is that the blood flow of the body changes and the vessels relax. 1 cup of coffee a day is known to have pain-relieving properties. However, care should be taken not to consume coffee frequently. Experts generally recommend drinking a black Turkish coffee. In this way, other benefits are also utilized. One of the most effective solutions for tension and stress headaches is to take a shower with warm water. After the shower, which completely relaxes the body, the nasal passages will be opened and you will notice that your headache is relieved very quickly. When you have a headache, taking a short break and going outside can be very relaxing. More fresh air and oxygen will relieve the headache. If you do not have the opportunity to go outside, opening the window and ventilating your environment for a while will also make a big difference. It is recommended to massage your temples, from between your eyebrows to your forehead and from above your nostrils to the corners of your eyes by stretching your skin. This method, which is also recommended by experts, will relieve your headache. Headaches are sometimes caused by being exposed to too much disturbing light and being in noisy environments. For this reason, a short rest in a quiet place with little light will help your headache.
You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.